Let's talk about the DNA viruses. And we already know the DNA virus is mnemonic. The DNA virus is mnemonic, I already told you. That is happy. They are very happy to be DNA viruses. And what comes in the happy family? H square, herpes, and hepatitis. A is adeno, P is parvo, another P is papova, and pox. These are there. And rest of all others are RNA viruses. But you need to know that what comes in herpes, what comes in papova viridae family. A lot of other viruses also there. Now, guys, first of all, we'll talk about the herpes family. And this herpes family is having certain subfamilies like alpha viridae, okay, beta viridae, and gamma viridae. Alpha viridae, beta viridae, and gamma viridae. In the case of alpha viridae, what comes? HSV1, HSV2, and HHV3. Okay. Beta viridae is HHV5, 6, and 7. And gamma viridae is HHV4 and 8. HHV4 and 8. Now, these particular alpha viridae members, they affect the ganglions. And these particular one, they stays in your ganglion. Like HSV1 stays in trigeminal. HSV2 stays in sacral ganglia. And they stay there for lifetime. Okay. So they affect the ganglions. HHV5, 6 and 7, they affect up salivary glands. They affect up salivary glands. Then you have gamma viridae, HHV4 and HHV8. HHV4 is termed as Epstein-Barr virus. HHV8 is termed as Kaposi's sarcoma causing virus. Okay. Kaposi's sarcoma causing virus is HHV8. HHV4 is Epstein-Barr virus. And these two, in fact, mostly it is Epstein-Barr virus, which affects the B cells. Why only B cells? Because they have a predilection towards CD21CR2. This particular stuff, CD21CR2. And because of that only what happens? Polyclonal proliferation. Okay, because of that only what happens? Polyclonal proliferation of B cells, and thereby leads to what? Cancer. Thereby leads to what? Cancer. And the similar thing can happen for the Kaposi sarcoma also. And this was asked in the last NEET PG, that what are the receptors because of which this particular polyclonal proliferation happens, that is CD21CR2. Now, affecting of these particular ganglions, you should know one thing, that what is the full form of HSV? Herpes simplex virus 1, herpes simplex virus 2. HHV3 is the other name of chickenpox virus. Okay, it is the other name of chickenpox virus. And here only I like to tell you, even though it is having what in the name? Pox, but it is not a pox virus. It's a herpes virus and herpes virus disease. What is the name of the virus? As such, Varicella Zoster. Okay, Varicella Zoster. And here only I like to tell you, all the students, they are confused up that Varicella Zoster is the name of the virus, but as it is in the ganglion, so it can reactivate. So reactivation of chickenpox is having the other name, and that particular reactivation is termed as what? Herpes zoster. That reactivation is termed as what, guys? Herpes zoster. So remember this particular one, the reactivation is termed as herpes zoster or shingles. You call it as shingles also. This question also came in the exam, so you should also know that. Now, regarding the HHV5 stuff, that is the Cytomegalovirus. We call it as what? Cytomegalovirus. 4 I already told you, Epstein-Barr virus. 8 is Kaposi sarcoma causing virus. Okay. Now, how to remember that HHV5 is CMV? CM, you choose for how much years? 5 years. Epstein-Barr, bar opens up to 4. Okay. in the morning. Students only have made this. But yes, in the exam might have, like, it might help. So you should also know Epstein-Barr is, the bar opens up to 4 in the morning. So Epstein-Barr is HHV4. Is it fine? So this way we can remember of this particular list and what they affect of. The first of all, we'll talk about the HSV1 and HSV2. HSV1 affects above the waist, okay, and HSV2 affects below the waist. So this you need to know, that HSV1 affects above the waist and HSV2 affects below the waist. This particular one means HSV1 mostly cause the lesions above the waist and HSV2 cause lesions below the waist. But remember one thing, they can crisscross also. HSV1 can cause below also and HSV2 can cause above also. That is not a strict rule. But basically what is observed, that HSV1 affects above the waist and HSV2 affects below the waist. Is it fine? Now, as far as the nuclear material of this is concerned, herpes simplex virus or herpes for that matter, so double stranded DNA they are, and they are linear. Okay, the double stranded DNA, it is linear. Another important thing is that these particular fellows are enveloped. They are enveloped viruses. What they are? They are enveloped viruses. And talking about the various lesions done by them, the diseases done by them, the mucosal involvement and all that. So in the mucosal involvement, if somebody asks you, that is most common site is buccal mucosa. Okay. Which is the lesion observed? The lesion observed here is gingivostomatitis. Gingivostomatitis. Gingiva is involved up. Okay. So gingivostomatitis is there the lesion. Now, most common recurrent herpes lesion, if somebody asks. The most common recurrent herpes lesion, which comes again and again. And the problem of herpes is, it's all infections are very painful. Okay. So which one is there? That is herpes labialis. Okay. Herpes labialis. The most common recurrent herpes lesion is herpes labialis. So remember that particular aspect also. And most commonly, this is a site which keeps on coming again and again. So that is important to know. Regarding the cutaneous involvement. In the cutaneous involvement, the most common site is face. Okay. And the lesion observed in chronic eczema patients. Okay. Lesion observed in chronic eczema patients is what, guys? What is the lesion observed in chronic eczema patients? That particular one is termed as herpetic eczema, or you can say eczema herpeticum. Fine. So this is what is the lesion observed in a chronic eczema patient, that is eczema herpeticum or herpetic eczema. Okay. And it is over the face, mostly over the face. Other than that, you need to know something about these particular names. One is Whitlow and one is herpetic gladiatorum. Okay. One is Whitlow and one is gladiatorum. This particular Whitlow happens to be in whom? Doctors and nurses. Okay, suppose they have touched any lesion with these fingers. So this particular virus will be incorporated inside them and they will keep on having this recurrent lesion of fingers. So that is termed as herpetic Whitlow. Okay, so what is involved up in that? The fingers of these doctors and nurses. Important is never touch a herpes patient without gloves. And if you do so, recurrent lesion might happen to you. Glidotorium is a mucocutaneous lesions observed in wrestlers. Okay, observed in wrestlers, and you can remember them by this gladiator wrestlers. Okay, so this is what is the cutaneous involvement, guys, which you need to remember. After that, if we talk about the ophtha involvement, the eyes involvement, it leads to the formation of acute dendritic ulcer. And acute dendritic ulcer, what is the drug of choice for this particular one? Important is drug of choice is acyclovir. Okay, that is being used in the form of eye drops or topical one. So that is the eye drops, acyclovir. And which particular drug is contraindicated? Contraindicated is steroids. If you give the steroids, they enhance this particular condition. Okay, rather than curing off, that is enhancing the disease. That's why they are contraindicated in the case of acute dendritic ulcer. And this particular ophtha involvement, if it is not taken care of, then it leads to what? Corneal blindness also. Because of the ulcer formation, the blindness might happen up in this particular ophtha involvement. Okay. Now, after the ophtha, regarding the CNS stuff. Okay, CNS. In the CNS, this particular one was asked also and can come again also. It associates with temporal lobe encephalitis. And how you'll observe that? You will observe this on MRI. Okay, you will observe this on MRI, that which particular lobe is involved up, and it does this temporal lobe encephalitis. And you should know that herpes simplex virus 1 is one of the common causes of encephalitis. Okay, in fact, some says it is the most common cause, HSV1. And mainly which lobe is involved up? Temporal lobe. Besides this, there is one sort of a meningitis termed as Mullaret's meningitis. Okay, Mullaret's meningitis. And Mullaret's meningitis is what? It is a recurrent lymphocytic meningitis. Okay, it is a recurrent lymphocytic meningitis which is observed in this, that is Mullaret's meningitis, and it is lymphocytic in nature. Lymphocytes are there in this particular one when you go for the CSF examination. This was also asked. This is a asked question, temporal lobe and Mullaret's meningitis. Okay. Now, regarding the genital involvement, and obviously which one does more? HSV2 more than HSV1. It involves up in the genitals, and there is bilateral vesicular pustular, okay, and red color lesions observed. Vesicular, pustular, red color lesions are observed in this particular genital involvement, and obviously I already told up that most of the lesions of this, they are painful. So this is also painful. Now the thing which comes up here is that suppose there is a pregnant female, and this particular pregnant female is around the EDT, okay, expected date of delivery, and at that particular time she acquires the infection of HSV2, because that is what is coming, doing up the more of a genital lesion. HSV2 infection happened. So what you have to do to avoid transmission to the newborn? What you can do to avoid transmission to the newborn? Okay. So answer to this particular question is that you should give what? acyclovir injection and should go for cesarean section. Okay, not being going for what? Vaginal delivery in this particular one. And if it is not around the EDD, before it is, okay, means in those particular trimesters it happens. So it can lead to a severe stuff that is termed as neonatal herpes. Okay, it leads to neonatal herpes, or you can say a sort of a congenital features, they might come up in that particular child. Okay, so that is also there. And this particular thing also is being asked, that what to do if the infection is acquired around the EDD. Now, guys, other than that, if we talk about the lab diagnosis, in the lab diagnosis for HSV1 and 2, okay, obviously you will go for what? PCR, that is the best. It was asked also, okay, this is the best. Other than that, you can go for ELISA. And for all the things, the same story is there. That is ELISA, HSV1 and 2 or PCR. But PCR is said to be the best for the diagnosis of HSV1 and 2. Okay. Other than this, another important stuff is Zank smear. The another important stuff is Zank smear. And this particular Zank smear, suppose there is a lesion here. Okay. You take the tissue biopsy from this particular site and stain up with Toledan blue. And after this particular staining, what you observe? You observe Zank cells. Okay, what you observe after this? Zank cells. And what is Zank cells? Zank cells are multinucleated giant cells. Multinucleated giant cells means lot of cells. They fuse up with each other, and what they produce? A multinucleated giant cell. That is what is termed as Zank cells, and that is characteristic seen in HSV1, 2, and even, guys, in HHV3. Another INI-CT question. Means in chickenpox also, you can induce up the Zank smear. Okay. Talking about the cytopathic effect of herpes, Simplex virus, HSV, that is rounding. It does rounding of the cells. Okay, after the infection of this particular one, suppose you put in cell lines, it will do what? Rounding of the cells. Herpes simplex virus. So this is termed as cytopathic change. This is termed as what, guys? Cytopathic change. Other than that, what else? Other than that, what else? Important is that intranuclear inclusion bodies, they are also observed, guys. Intranuclear inclusion bodies, they are also observed from the lesions, and the name of that is quadri type A. Okay, quadri type A, and that particular quadri type A is also termed as Lipskull's inclusion body. That is also termed as what, guys? Lipskull's inclusion body, quadri type A. Is it fine? So these are the various tests which you can go out and do to identify the infection of HSV1 or HSV2. Okay. Now after this, let's talk about the HHV3. In the case of HHV3, you should know that HHV3, how to remember the HHV3? Remember them like this. We have called it as chickenpox virus. And what is the third alphabet, guys? The third alphabet is C. So remember from that particular one, that chickenpox virus is which number? HHV3. Is it fine? Other name for the same is Varicella Zoster. The other name for the same is what? Varicella Zoster. Okay. Now, what is the portal of entry? How does the infection of this happens? What is the portal of entry? The portal of entry is respiratory tract. The portal of entry is respiratory tract and even conjunctiva. Even conjunctiva and respiratory tract, they are the portal of entry. Then, once they enters up, what is the incubation period of this particular disease? Remember the fever with rash, mostly they have the incubation period of this 2 to 3 weeks. For this, it is being said 14 to 16 days exact one. These are the incubation period of chickenpox. Now, after this incubation period, after this incubation period, this particular one is having a infectivity period also, which revolves around the eruption of rashes. And which sort of rashes are most commonly seen? Obviously, vesicular rash. Vesicles are there, fluid filled. Rash 2 days before the rash eruption and 5 days after the rash eruption. This is termed as infectivity period of what? Infectivity period of this particular chickenpox. Some books they write until the scab falls, you should not send the child to the school. So if both the options comes by chance, they're very happy to create a controversy every time. So 2 days before and until the scab falls will be a better answer rather than the 5 days after. So this should be remembered properly. Other than that, if I ask you that which type of pattern is observed of the rash here, the answer is centripetal rash. Means mostly on the trunk, and in the distal ones it is less. Centripetal rash is there, and this particular rash is termed as pleomorphic rash. Why? Because this one sometimes it is vesicular, at the same time in a lesion nearby only you will see the pus. So it can be a vesicular lesion, it can be a postural lesion, and that particular one is correctly described as what? Dewdrop on rose petal appearance. Another frequently asked question. Dewdrop on rose petal appearance. That typical appearance is observed in the case of which particular one? Chickenpox. Now, besides all this, what else you should know regarding the chickenpox? That the most common infectious entity which is observed in the case of chickenpox is what? Secondary bacterial infections. Secondary bacterial infections, and they can involve the lungs, can lead to pneumonia or to the skin lesions. But there's secondary bacterial infection, which is the most common infectious entity, which happens to be in the case of chickenpox. This is one of the things. Other than that, guys, what else you should know? That which is the most common extracutaneous involvement. The most common extracutaneous involvement, and that is brain. That is brain. And the most dangerous complication, most dangerous, it is varicella pneumonia. It is what? It is varicella pneumonia. Which is the most dangerous one? Varicella pneumonia means itself chickenpox is causing pneumonia, and that is a definite problem. It can definitely turns out to be like for the mortality also. So most dangerous is varicella pneumonia. The most common is secondary bacterial infections. Most common extracutaneous involvement is brain, and most dangerous is varicella pneumonia. Is it fine? So these are the important points which you should know regarding the chickenpox stuff. Other than that, if this particular chickenpox infection happens to be in the pregnancy. Okay. Now suppose any lady who had not it in the childhood got this infection and not the vaccination also, and got this particular infection of chickenpox in pregnancy. So infection happened in pregnancy can pose serious threat to the newborn in the form of congenital varicella syndrome. In the form of what, guys? Congenital varicella syndrome. And congenital varicella syndrome, what we have in this? Chorioretinitis. This everywhere comes. Choroid and retina inflammation, chorioretinitis. Other than that, what you can have in this? Chorioretinitis, one of them. Limb hypoplasia means short limb. Okay. Microcephaly, short head. Okay. Then cicatrizing lesions. And these cicatrizing lesions are what, guys? That scarring. Scarring is observed over the skin. Scarring over the skin. So that is termed as cicatrizing lesions. So these all, they are the features of congenital varicella syndrome. Okay, congenital varicella syndrome. And if we talk about the chickenpox vaccine, so which particular thing vaccine is there? Chickenpox vaccine, the strain of it. This is also asked question. The strain is Oka. Which is a strain which is like there for the chickenpox vaccine? Oka strain. Okay. Other than that, another entity is also there. Whenever the infection of chickenpox happens and it is like cured up in some sort, so do you think that this particular virus goes off to the body? No, it stays there. And stays where? Stays in your ganglion. And whenever you are under any sort of stress, emotional stress, love breakdown affair, exam stress, old age stress, all those particular things, they come. So after that particular stress and all, there is observed what? Reactivation. What is being observed? The reactivation. And the reactivation of this particular one is termed as, I already told you, herpes zoster or shingles. Herpes zoster or shingles. So the reactivation of this particular one is termed as herpes zoster and shingles. Okay, remember like this, that after a love breakdown affair, you have got single. So that is shingles. Fine. It is a two types. One is herpes zoster oticus and one is herpes zoster ophthalmicus mainly. Okay. So this herpes zoster oticus, also termed as Ramsay-Hunt syndrome. And in this Ramsay-Hunt syndrome, there is an involvement of a ganglion that is termed as geniculate ganglion. This is involved up. Okay, geniculate ganglion is involved and it leads to which palsy, guys? Bell's palsy. It leads to which palsy? Bell's palsy. And this particular Bell's palsy can happen overnight. Along with that, you will observe vesicles over the external auditory canal. Okay, cheeks and other areas. It can happen that you can find what? Vesicles. And which ganglion is involved? Geniculate ganglion. Okay, so this is regarding the herpes zoster oticus. Herpes zoster ophthalmicus, in that the trigeminal nerve is being involved up, and that to which branch? Ophthalmic branch of trigeminal. That is involved up. In this, on the face, characteristically you observe single-sided lesion. Okay. Obviously, in the case of herpes zoster, It is single-sided lesion only. And why does it single-sided stuff? Because there is a dermatomal involvement. Dermatomal involvement. And this dermatomal involvement is from T3 to L3. Means it is thoracolumbar. Dermatomal involvement is thoracolumbar. T3 to L3 is observed in this particular one. Fine. And when you see this particular example or like what do you say, in the OPD you see this particular case, by those single-sided lesions only you will be able to identify the patient wonderfully. In that there is one thing, if the tip of nose lesion is present, okay, then it is being said that there is 100% eye involvement. And what in the eye involves up? The cornea. What in the eyes involves up? The cornea. If the tip of the nose lesion is present, 100% what is involved? The eyes. That is ophtha involvement is there, 100% if the tip of nose is there. And this is termed as Hutchinson's rule. This particular rule is termed as what, guys? Hutchinson's rule, which is observed in this particular one because of the nasociliary nerve involvement by both. So whenever you see on the tip of nose lesion, you should always ask the patient go for the ophtha examination, because corneal ulcer can form, which later on can lead to corneal blindness. Okay, so that particular thing is to be observed in this particular stuff. As far as the lab diagnosis is concerned, the lab diagnosis again revolves around what? It revolves around the same stuff, that is the Zank smear. Okay. Other than that, you have PCR or ELISA for herpes zoster virus, or you can say HHV3 only. The virus is HHV3, human herpes virus 3. Okay. So this is there for both, like chickenpox also, and for this herpes zoster also, the same thing you will go for, that is PCR and ELISA. That sounds good. And for the Zank smear also, you can go to find out the stuff. Okay. So these two important things you need to know regarding the herpes simplex virus 1 and 2. And along with that, in the alpha viridae stuff, we have this HHV3 also, that is chickenpox virus. Is it fine? After doing the herpes, let's see about the pictures of it. The herpes simplex virus, this one is a double-stranded linear DNA, I've already told you. And this is what is the picture of that herpes simplex ones. Having a lipid bilayer envelope, nucleocapsid, DNA, this particular one we are talking about. It is also having these glycoproteins, GH, GL, GB, GC. Okay. So this is basically the important thing to remember is linear DNA in this. This is that herpes labialis, which is termed as the most common recurrent herpes lesion. The most common recurrent herpes lesion, that is what is termed as herpes labialis. Multinucleated giant cell in the Zank smear of a tissue scraping looks like this. This is that multinucleated giant cell formation, also termed as Zank cell, and they are helpful to identify which all HSV1, 2 and HHV3. All these three infections, they are being diagnosed up with the help of this particular Zank smear. The inclusion bodies which are observed in the cytomegalovirus, they looks like that. This is what is termed as owl eye appearance. And if you remember off, they are mainly both intranuclear, intracytoplasmic, and this is actually intranuclear mostly, which looks like an owl eye. So this intranuclear intracytoplasmic inclusion body, it is having this particular shape, that is owl eye appearance. Okay, owl eye appearance in this particular one. This is Kaposi sarcoma, as I told you. It does lung lesions also, oral lesions also, and it is being caused by this HHV8, human herpes virus 8. Okay, I have already told up the lesions done by this is KPC. One is Kaposi sarcoma that everybody knows. Another one, they're also being asked nowadays, primary effusion lymphoma and Castleman's disease. And Castleman's disease. Okay. So these are the important ones which you need to know. Other than that, you can have this. This is Rosola infanta, done by HHV6 mainly. HHV7 also can do, and these are termed as those Nagayama spots. Okay. This is infectious mononucleosis tonsillitis. I told you it is coming in a DD of pseudomembrane. So pseudomembrane is formed up in infectious mononucleosis also. It comes in that particular DD, and when you give the drug, ampicillin and all, there might be a fixed drug eruptions observed. Okay. The smallpox is having centrifugal appearance of the rash, and chickenpox is having centripetal, more on the trunk, distally less, and the other way around is smallpox. Okay, so this is the chickenpox rash. This is that oral hairy leukoplakia of the tongue, termed as Epstein-Barr virus infection in AIDS patient, lateral side of the tongue. You observe this whitish color lesions. Okay, this is Burkitt's lymphoma, also termed as tumor of jaw, and this particular infection is common in Africans and having which type of appearance? Starry sky appearance. Which type of appearance is observed in this? Starry sky appearance, and this is the tumor. This is the Paul Bunnell test, and the Paul Bunnell test, you know, is positive in the case of infectious mononucleosis, and the card test of this is monospot card test, and this monospot card test is also found to be positive in this particular one. Okay, this is that herpes zoster ophthalmicus, single-sided lesions. Ophthalmic branch or trigeminal nerve is involved, and this particular rule is termed as what? Hutchinson's rule. Means if the tip of nose is involved, 100% eye involvement is there, which later on can lead to what? Corneal ulcer, and later on blindness. Okay. Now, this much is there up till. After that, we'll talk about the other images of the other infections. Let's talk about the CMV. CMV is Cytomegalovirus, and I've already told you what is the number? HHV5. How to remember? CM we choose for how much years? 5 years. So that is human herpes virus 5. Is it fine? So this particular CMV, cytomegalovirus, which is also termed as HHV5, this particular one, important to know is that the cytomegalovirus characteristically produce a appearance that is termed as oval eye appearance of infected cell. And what is this oval eye appearance of infected cell which is produced by CMV? It is actually intranuclear and intracytoplasmic inclusion body. Okay. So CMV is also one of them which produces intranuclear as well as intracytoplasmic inclusion body, and they give it a appearance that is termed as what? Oval eye appearance. So remember this particular name also. Okay. Other than that, this question was asked. They have given up a picture of oval eye appearance in the exam of INICT, and down they have written up certain features of a syndrome that is termed as congenital syndrome features. Okay, obviously they have not written that they are the features of CMV only, but they have written up a syndrome features, and they were of CMV obviously. And what were written up? That the most common is hepatosplenomegaly. Okay, petechial lesions, then calcifications, convulsions. Okay, calcifications, convergence, micro or macrocephaly. Okay, micro or macrocephaly. Other than that, MR, that is mental retardation. That is mental retardation. All these features, they are observed with congenital CMV syndrome. Okay, which all? Hepatosplenomegaly, petechial lesions, calcifications, conversions, macrocephaly, and mental retardation. Because this is petechial lesions, it looks like a blueberry muffin also. Blueberry muffin. Okay. And this is the most common feature of congenital CMV. This can also be asked separately. So what they have done, they have given that particular image of owl-eye appearance and they have given up these features of congenital syndrome and they asked up that is which particular virus, CMV. And the next probable question might be that what is the sample of choice for this particular congenital CMV syndrome diagnosis? Answer to that is urine. And in the urine, you want to find out the CMV antigen termed as PP65. In this particular one, by various methods, you can demonstrate that by ELISA. Okay. And number of others are also available by which you can find the CMV antigen in this particular one. Okay. Besides all this, what else you need to know regarding the cytomegalovirus? In the cytomegalovirus, if somebody asks you that which all other lesions are done by this particular virus, so CMV associates with mononucleosis like syndrome. Okay, it associates with mononucleosis like syndrome. Another one is that the cytomegalovirus associates with CMV pneumonia in post kidney or bone marrow transplant patients. Post kidney or bone marrow transplant patients, they are predisposed to get this particular pneumonia up to 4 weeks, okay, because of CMV. In whom? In post kidney and bone marrow transplant patients. CMV also associates with CMV retinitis. And this particular CMV retinitis happens to those whose CD4 count is less than 50 in HIV positive individuals. Okay, in HIV positive individuals. So first of all, if we want to talk about for the mononucleosis like syndrome, the mononucleosis like syndrome, it is having fever, even rash, okay, flu-like features. Along with this flu-like features, they have certain big lymphocytes, and name of those lymphocytes is what, guys? Atypical lymphocytes. So atypical lymphocytes, which are actually the CD8 T cells, they are present in this also, and they are larger than the normal ones, so that's why they're termed as atypical lymphocytes. All things are same like infectious mononucleosis. Only thing is the test, which is a heterophile agglutination test termed as Paul Bunnell test. The Paul Bunnell test, which is a heterophile agglutination test, is found to be negative in the case of mononucleosis like syndrome. This is what is important. Okay, this is what is important here. Then 4 weeks to even 4 months, okay, they are predisposed to get what? CMV pneumonia, and obviously a viral pneumonia, so atypical pneumonia it is. And this happens in whom? Post kidney or bone marrow transplant patients. Okay. So this is also one of the ailments which is to be remembered. Now, as far as the CMV retinitis is concerned, whitish color, granular infiltrates, they are observed with retinal hemorrhages in the CMV retinitis, and they give appearance of pizza pie retinopathy. Okay, pizza pie retinopathy, and that is what is termed as CMV retinitis. What is the drug of choice? This particular drug plays a wonder role to arrest the progression of this particular retinitis, that is ganciclovir. Ganciclovir or ganciclovir. This is the drug of choice for this CMV retinitis. And CMV retinitis mostly happens at a CD4 count of less than 50, and is at this CD4 count of less than 50. What else can happen? At this, remember, in the AIDS patient, when the CD4 count goes less than 50, another important infection, if you remember off in the bacteriology, we have done that, MAC, and that is Mycobacterium avium complex infection. Okay, Mycobacterium avium complex infection. This can also happen up when the CD4 count is less than 50. Is it fine, guys? So this is regarding the CMV retinitis stuff. Okay. Now, as far as the lab diagnosis is concerned, you go for what? You go for PCR. PCR for cytomegalovirus DNA, CMV DNA. Okay. Other than that, we already have seen antigen detection by ELISA. Okay. That is PP65. That can be done. Certain immunofluorescence based methods we can go for. Okay, immunofluorescence based methods to diagnose up the CMV. Okay, then a special method, shell vial technique, to culture the cytomegalovirus can also be used. Special method. They are slow virus, means they grow very slowly. So for them, a special technique is used to culture them, shell vial technique. This is also another things to be remembered regarding the cytomegalovirus stuff. Then you can culture it in human fibroblast cell line. And you know, it is which cell line, guys? This is semicondylar cell line, which allows 10 to 50 subdivisions or subcultures, also knows by the name of WI38. They're also known by the name of what? WI38. This much you need to know regarding the cytomegalovirus. Okay. Now talking about the gamma vernifellows, Epstein-Barr virus. And Epstein-Barr virus is which number, guys? HHV4. Human herpes virus 4. The bar opens up to 4 a.m. in the morning. This we know. Okay. And why does it affect the B cells only? Because over the B cells, which receptors are there? CD21CR2. Okay. How to remember that particular thing? 21 is the legal age of drinking in India. It is just for the absurd association, for remembrance purpose. Don't take it seriously. Okay. So that is HHV4 affect the B cells, and the legal age of drinking is what in India? CD21. That is 21. CR2, CR stands for complement receptor. Now, that particular one behaves like a T independent antigen. Okay, this virus behaves like a T independent antigen and directly acts on the B cells and leads to the polyclonal proliferation. It directly acts and leads to what, guys? Polyclonal proliferation of B cells. And that is what? That is the cancer. That is what? That is the cancer. Now, various cancers. One is nasopharyngeal carcinoma. And this naropharyngeal carcinoma is very common in China. And why it is common in China? Because they associates with having what? Smoked fish. Okay. And that is what is a risk factor for the developing this nasopharyngeal carcinoma. Other than that, Burkitt's lymphoma. Burkitt's lymphoma. Okay. And this Burkitt's lymphoma like manifest in the form of jaw tumor. And it is common in Africa. It is common in Africa. And as far as the pathology point concerned, regarding Burkitt's lymphoma, which type of appearance? Starry sky appearance. That is observed in this particular one, Burkitt's lymphoma. Then you have Hodgkin's and non-Hodgkin's lymphoma. Okay, Hodgkin's or non-Hodgkin's lymphoma, HL and NHL. These two lymphomas, they can also be done by this Epstein-Barr virus. This particular one associates with oral hairy leukoplakia, and this was asked in the NICT exam. Lateral side of the tongue, you see a whitish color lesions that is termed as oral hairy leukoplakia. That is being also done by Epstein-Barr virus, common in whom? In HIV positive individuals. Another important thing. This particular one associates with even tonsillar carcinoma. Okay. Post transplant lymphomas. They also being associated with Epstein-Barr virus. This particular one associates with Duncan syndrome. Okay, Duncan syndrome. And what is Duncan syndrome? X-linked lymphoproliferative syndrome. X-linked lymphoproliferative syndrome. That is termed as Duncan syndrome. Okay, so this is also one of them. Then the most important is infectious mononucleosis. The most important is which one? The infectious mononucleosis, which is also termed as kissing disease. Which is also termed as kissing disease, common in youngs, spreads through saliva. Okay. Now, this particular one, the main complaint the patient comes up is with sore throat. And when you ask as a doctor to open the mouth, okay, what you observe? You observe a pseudomembrane. Okay, pseudomembrane, it can be over the posterior pharyngeal wall or over the tonsils also. You can find this pseudomembrane. Okay. It comes in the DD of pseudomembrane, infectious mononucleosis. Along with that, the mononucleosis-like features, fever, rash, lymphadenopathy. These all things, they are there in this particular one also. Important is the CD4-CD8 ratio reverses for some time. Okay. It reverses for some time. Later on, it comes back to normal, but it reverses for some time in the case of infectious mononucleosis. Is it fine? And as a doctor, you give up for this sore throat ampicillin like drug. You observe after this the rashes over the body in the patient. So this type of question can also come in the form of case scenario that a person, a young person or a young male or female comes to the doctor with a sore throat. When you open the mouth, you see a pseudomembrane, and after that, you give for that sore throat ampicillin, and the patient develops rashes all over the body. Which is the likely cause of the disease? The answer is infectious mononucleosis, and they are termed as, because of this drug giving, eruptions happen. Okay, viral induced ones. So rash over the body is observed in this particular stuff that is termed as infectious mononucleosis. Is it fine? Now, regarding the lab diagnosis and all, in the lab diagnosis, again, the best is to go for PCR. PCR for VACA and IBNA. VACA is viral capsid antigen. Viral capsid antigen. And IBNA is Epstein-Barr nucleic acid. Epstein-Barr nucleic acid. So there are PCR for the VACA and IBNA. That can be done. Other than that, you can go for what, guys? In this regard, you can go for Paul-Bunel test. And the Paul-Bunel test, which is a heterophile agglutinationase, is found to be positive. The modification of the same in the form of card, that is monospot card test. This also is found to be positive in infectious mononucleosis. Is it fine? So remember this particular point also, that for the monospot card test also it is found to be positive. Paul-Bunel test is positive in the case of infectious mononucleosis. Is it fine? So this is regarding the infectious mononucleosis which you should know. Important is, like mononucleosis syndrome, mononucleosis like syndrome, atypical lymphocytes are seen here also. Means all the things are same except this, that the Paul-Bunel test is found to be positive here and it is negative in the case of mononucleosis like syndrome. Okay. Now guys, other than that, let's talk about HHV8. And this HHV8 is leading to a vascular tumor that is termed as human herpes virus 8 leads to the Kaposi sarcoma. And this Kaposi sarcoma is termed as the vascular tumor. And this is common in whom? In HIV positive individual. And in the HIV positive individual, one more vascular tumor is there. Can you tell me, guys? Bacillary angiomatosis. If you remember of Bartonella Hansley, Bartonella quintana leads to that. Here also it is same. So that is also a vascular tumor, but that is by bacteria. It is by virus. Now everybody knows about Kaposi sarcoma. What they have started asking is what else it does. It involves up the in causing up this particular disease, primary effusion lymphoma, that is also being done by HHV8, and also leads to Castleman's disease. Also leads to Castleman's disease. So HHV8 leads to Kaposi sarcoma, that is the vascular tumor in HIV positive. And along with that, it also associates with primary effusion lymphoma and Castleman's disease. The acronym for that particular one as a mnemonic you can remember of KPC. KPC. HHV8 leads to KPC. That is Kaposi sarcoma, primary effusion lymphoma and Castleman's disease. Kaposi sarcoma can manifest in many forms. It can involve the lungs also. It can produce the oral lesions also, and it can produce the skin lesions also. So this particular one can produce oral lesions. Okay, it involves the lungs also. Okay, so these are the primarily being involved of oral lesions and lung in the case of Kaposi sarcoma. Okay. Now there were two names, HHV 6 and 7. Okay. HHV 6 and 7, they don't have any name, first of all. And HHV 6, this particular one mainly leads to exanthum subitum. Okay. Exanthum subitum or Roseola infantum. Okay. Means both of them they does. Obviously more is HHV 6. Fine. And this HHV 7 leads to focal encephalitis. This HHV 7 leads to what, guys? Focal encephalitis. HHV 7. And they don't have any sort of a name. This exanthum subitum or Roseola infantum is having which particular spots? Nagayama spots. Okay, which particular spots are observed in this? Nagayama spots. This question might also be asked, that which spots are observed in the Roseola infantum? The answer is Nagayama spots. Is it fine? So guys, right from the alpha virni, beta virni, gamma virni, we have done all the herpes viruses. In the alpha, we have HSV 1, 2 and 3, that is chickenpox. In the beta, we have 5, 6 and 7, that is CMV along with the 6 and 7. And in the gamma, we have HHV 4 and 8. We have discussed all of them and they all are important. Okay, they all are very important. One thing is for sure for all of them, they all are double standard and they all are enveloped. Okay.